Let me actually click my screen. Okay, so hi and welcome. My name's Mel. I use they, she pronouns, and I'm currently about halfway through my master's in counseling for mental health and wellness here at NYU. Thank you for joining and giving me the opportunity to talk about something I'm super passionate about, which is grief. Um, the course that I attended was called The Big Picture: Prolonged Grief Disorder Treatment Principles and Procedures. It was a synchronous virtual workshop on January 30th from the Center for Prolonged Grief at Columbia. And I just want to start with that top line that grief is universal, but how we understand it is not. So hopefully by the end of this, we'll understand a bit more about grief and sort of how to treat prolonged grief, which is a newer diagnosis in the DSM. So, getting started. Um, Grief is a response to loss. So, with grief, it has universal recognizable features, but it is deeply unique to each person and really dependent on culture. There are mixed feelings and thoughts, and people think of grief in a lot of different ways. But one thing to kind of take away is that grief is permanent and kind of changes through time. This one is a little controversial, but there are no predictable stages of grief. Um, Contrary to Elizabeth Kubler-Ross's stages, which, for those not aware, are denial, anger, bargaining, depression, and acceptance in that order specifically, it's kind of considered outdated. Um, Grief research shows that we move in and out of these different points of grief in a very messy, erratic, unpredictable fashion, and how others respond to our grief sort of impacts that as well. Grief also brings up attachment issues. It provokes attachment wounds and loss-focused maladaptive coping strategies that can really derail the adaptation of grief. Besides that, it can accompany an additional slew of losses. So, loss of companionship, protection, sense of identity, family dynamics, certainty for the future. And then the grief itself can add to that experience of stress. So the ultimate goal is adaptation of grief. We want people to understand that grief is happening, that it's permanent, and how we adjust to change. By changing the expectations and accepting the new reality and the permanence of grief, we can change the behaviors that are occurring to fit the new world. Hopefully, we restore the capacity for well-being, and by transforming and integrating grief, get them back to a place that feels good. I will say that even if grief is transformed and integrated into one's life, it doesn't mean it's quiet. Grief, again, very messy, very erratic, and you can kind of move in and out of those places of grief kind of at any time. So, in talking about grief, this course specifically focused on prolonged grief, which is the response to a loss of another human individual. And that's how the DSM categorizes prolonged grief. But there's a lot of other different types of grief that are worth pointing out first before we get into like the meat and potatoes of the course. So the first one is anticipatory grief. This is like the natural response to our awareness of a forthcoming loss. So I think most people probably associate this with terminal illness diagnoses, the impending death, but my goal in life is to expand the notion of grief generally. And so, with that, I expand the notion of anticipatory grief into other areas. So, someone who loves working and doesn't want to retire, but maybe is being forced into retirement, that is anticipatory grief. Just to kind of, again, round it out. And with that comes disenfranchised grief, my personal favorite. Grief that's discounted by others because social norms don't acknowledge it as valid is the general definition, but you can think of it as any sort of loss that you feel this big grief, this emotional response to, that isn't recognized socially as the same as a death of a person. So I gave some examples here. I think pets are generally a great example of disenfranchised grief. You might meet people who are like, of course, that's your baby. And then you'll be like, what are you talking about? That's just a cat. So this is a good area for exploring loss and the associated grief beyond human death. Um, Cumulative grief is pretty much what it sounds like, multiple losses that haven't been processed or happen simultaneously. So think someone's had several major family members die over the course of their life, but they never processed any of them. Or, of course, like a major, car crash, something like that. Collective grief, I think we're all probably pretty familiar with this one at this point in time, but when a community or society experiences extreme change or loss, a whole group of people, also sorry if you can hear the sirens, I'm in Brooklyn, a whole group of people experience the same sorts of pain and grieving together. And then finally, complicated grief, which is sort of what we call prolonged grief now. It's being stuck in persistent and overly influential defensive coping. So, again, my goal is always to expand the notion of grief beyond just human death. And it allows for others to sort of validate the experience of grief, even if they don't necessarily perceive the loss as severe as the death of a person. So, with that in mind, we'll get to prolonged grief disorder itself. I do think it will be boring to read the DSM, so I'm just going to kind of put the highlights here. But the first criterion is death of a person close to the bereaved for 1 year or longer. Who defines close? Why is it 1 year? These are questions we can't quite answer, but these are the the standards of the DSM. Persistent, pervasive longing or preoccupation with the deceased. Three or more specific grief symptoms present most days. And just to tell you what those are, there are 8 in total. So difficulty engaging in ongoing life, emotional numbness, feeling that life is meaningless, intense loneliness, disrupted identity, marked sense of disbelief, avoidance of reminders, and intense emotional pain. So any 3 or more of those kind of on the daily. Significant distress or impairment in personal, financial, family, social, educational, occupational, any area of important functioning. And then finally, the duration and severity clearly exceed expected norms. I think again, the DSM loves to throw a line in like this, which is good. But the real meaning of something like this is that we have to be really self-aware as counselors of our own biases and expectations of grief, of loss, and really culturally humble around different expressions of grief. Important to note is that the grief itself is not something to solve. It's not a problem. It's not something we want to get rid of. It's kind of there forever. But the thing that makes it pathological is how distressing it is to the individual. So I wrote here, grief is not a problem to be solved. Defensive coping and inability to adapt may be. It's important not to pathologize the grief, but rather treat the impairment or the distress. So, the treatment itself from this course is prolonged grief disorder treatment, or PGT. It is a 16-session model based on empirical research that has planned sequence to first focus on loss and then on restoration. The emotional activation typically lessens as the sessions progress. This is the research, 71% improvement with this treatment versus 44 in control. And it uses 7 healing milestones sequentially, which we'll get to on the next slides. So the goals are to provide effective support and impart information about grief, about prolonged grief disorder, facilitate that adaptation to loss and address stuck points, foster open communication and respect about grief, about the loss, focus on client strengths and resources, which we should always be doing as therapists, And then employ active listening, support, validation, and guidance. Um, the main thing to kind of keep in mind is that bereaved individuals, especially at the point of prolonged grief, which is again a year or longer since the death, um, they need to feel heard with a sort of unconditional acceptance and a feeling that the counselor is willing to take on the pain that they're still experiencing, and oftentimes are not getting that validation from people in their life at this point in time because, again, that social acceptance level of whether or not people think it's okay to still grieve after a year. So, these are the seven healing milestones that facilitate the adaptation of grief. Each one has a specific procedure associated with it, and I'm not going to go into each one here, but just so you can see the sort of progression of those milestones. The training didn't specify exactly uh, how long you do each one for. But what I will say is what I've gathered is that you do the first four kind of over the first four sessions, and then each of the other three are like 3 to 6 sessions apiece. And then, of course, there's an intro session and a termination session. So I think it's kind of up to the discretion of the counselor, but it wasn't completely specified, but that's the general idea. So, getting into those milestones and what you do. The first one is the goals for milestones 1 and 2 are to understand and accept grief, as well as manage the grief emotions. So, that's done through psychoeducation and grief monitoring. And so, this is an example of the grief monitoring chart. Um, it encourages people to get to know their grief and understand that it waxes and wanes sort of in intensity throughout the day, throughout the week, throughout the month, and just kind of be aware of what's happening with their grief. And theoretically, you're supposed to have clients start this at the end of the first session and do it daily through the entire treatment. 16 sessions is approximately 4 months, and asking someone to do a grief log every single day for 4 months may be a challenge. But just getting them thinking about grief is really the thing, and how it shows up for them, how it changes is the important part. The next third milestone, the goal again is seeing a promising future. So we do that with aspirational goal work. Um, Being able to see the future is sort of really important for that adaptation. And so re-engaging clients with interests and hobbies um, that they, values, anything that they find comforting that maybe they gave up in this grief, helps to facilitate the adaptation. Um, One important note that they stressed in the training is that it's not an expectation that the client will fulfill the goal by the end of treatment. It's just to get them thinking about the future as something that is viable, essentially. So the next milestone is goal strengthening relationships. So you want to do that by bringing in a supportive witness. I have a bit of mixed feelings around this one myself, but the basic premise is that belonging and mattering are a basic human need. So if you can restore the social connection with someone in their life who knew them before the death and maybe knew the deceased as well, that can help, you know, bring some more connection and more support in their life generally. The main goals of this are you want to discuss the relationship between the people in session. You want to get the visitor's perspective on how things have changed since the death, and then kind of have an open discussion of grief and how we adapt to loss, and see how that friend or family member can support the person through this process. So the next milestone is, again, the goal is telling the story of the death. So that's done through imaginal revisiting. This is definitely my favorite of the milestones. This is how it's done. It's done over 3 to 6 sessions in a very ritualistic storytelling way. the key thing with this is that it starts from the moment the person learned about the death, not from everything leading up to the death, and then having them tell the story of from that moment forward for about 10 minutes, and then processing that story for about 10 minutes. And then there's a follow-up of setting the story aside, so like some grounding, and then rewarding activity. The idea here is that the storyline will sort of morph and change with repetition, and it helps to build new meaning and understanding of what's happened while simultaneously lessening the emotional pain through that ritualistic retelling. So, very similarly, the next milestone, the goal is living with reminders. So, you do that through situational revisiting. And it's very similar to in vivo exposure for like OCD and stuff like that. But basically, the client would create a list of things that remind them of the deceased and sort of kind of address them in session and get through them each, over and over and over again for 3 to 6 sessions or so. Um, and try to reduce the avoidance of these reminders and reduce the painful emotions. And then also simultaneously bring back the memories, bring back the pleasure, bring back the joy. As you can maybe imagine, pictures are very commonly used for this, and they're really very effective. So the last milestone, the goal is connecting with memories, and the procedure is just that, memories questionnaire and imaginal conversation. The course had 5 questionnaires. 3 were positive memories, 1 were negative, and 1 was mixed. And the idea is that the relationship, while the person has died, the relationship still can provide comfort and hope and meaning to the person in the room. And that memories, often when someone has died, we forget all the negative qualities of them, which can be a protective thing, but it also sometimes helps to put people on a pedestal that might not make it easy to get through the grief of them. So theoretically, you have them fill out these forms, and it kind of balances back out those positive and negative memories and creates new meaning for the person. And then you can invite them to have an imaginal conversation with the person, similar to like empty chair, where they're playing both roles, and imagine how that person is responding. So for the final slide, just an expanding of this treatment. It again is for prolonged grief, which is 1 year or more. Um, but what do you do for a recent loss? So there's a couple of pieces you can take and a couple of things you want to be mindful of. Focus on psychoeducation around grief reactions. You want to normalize and validate. Help them connect to intrinsic motivations, interests, self-care, and future thinking. Talk about the loss and engage with reminders at a slower pace, for sure. It's going to be more acute. And so you just want to be very, very careful and mindful. Similarly, with non-death loss, that area of disenfranchised grief, one of the key things is going to be psychoeducation around disenfranchised grief. Validate and normalize grief and loss, as well as the lack of social acceptance. Identify important connections and people that can externally validate and normalize, and talk about the loss and what it means to them. Notice what especially bothers them about the loss. A lot of times with this disenfranchised grief, the lack of social acceptance is really the biggest issue around it at a certain point in time after, the loss has occurred for a while. So really getting to the root of what is causing the most pain and how can we address that. And then finally, with multiple losses, you kind of have to address each one at a time. And you may need to find that the person needs to prioritize. I have very conflicting feelings about that. How do you prioritize when they're all important family members? But nonetheless, it is important to go one by one. The good news is that usually subsequent losses are worked through at a faster pace than the initial one because they have a bit of experience working through and integrating their grief. So that is it for me. Thank you so much. hopefully everyone understands grief a little more and got something out of this. Thank you for having me. And if anyone has any questions or feelings or anything at all, you can email me. My email is mtf9467 at nyu.edu. Yeah, that's it. Thank you.
Thank you. Does anyone who's currently here have any questions? You can just unmute yourself.
So one thing, thank you, Mel. This was wonderful. Like truly amazing. One thing I wanted to ask is with all the different forms of grief, and I really like the system. I think that this is so much better than all of the steps, but is there what happens, I guess, if like someone has multiple forms of like it's either the prolonged, the acute, and then, the non like person grieving, like how do you navigate that as a clinician or using this method?
Yeah, I think the one major restriction of this method is that it is designed sort of through the DSM diagnoses. So this will only most effectively apply to someone who is in that prolonged grief category. That said, I think just going back to that different types of grief slide, like I think you can absolutely be in multiple types of grief over one or multiple events happening. And so I think, and this is not a satisfactory answer, but it's like clinical discretion, kind of assess what is the most acute, important grief to the person, and then kind of make your adjustments from there.
Thank
Mel,
you.
I have a question.
Sure.
Um, I'm assuming that this program that you presented is basically for individual therapy, but can it also be used in a group setting?
So this is definitely for individual, with a group setting, like the presenters had mentioned it. With a group setting, I feel like what they said was that it gets to a level of support, which in and of itself is very helpful, but it removes the sort of like structured element that is what they're testing. So because it is so ritualistic and it has to be done in this specific order, I think more people will derail that. That said, grief groups and grief support groups are tremendously helpful for a lot of people.
Thank you.
Yeah.
I have a question. You said for milestone 4 that you had issues with it. What might you change about it?
Yeah, that's a great question. Just pull it up for everyone. So my issue with the visitor is that the visitor comes in with their own grief if they knew the person who died. And we have no ability to assess on the fly whether or not they've been able to process their own grief or how they've shown up for the friend or the person, family member prior to this session, other than the like maybe questions we've asked. Um, I would change it to a supportive person in the person's life who maybe specifically did not know the deceased as well, and then see how that goes, and then maybe introduce a different supportive witness who did know the deceased. Because the first one can still comment to the change in the client before and after the loss. Um, but the second one, like the way it's set up, it just has a lot more baggage that I'm not sure is beneficial, but it certainly could be.
Yeah, I completely get that. Thank you.
Yeah.